very rapidly in response to infection and chemicals that are released from white blood cells and so on and so forth. So you get this rapid replication of skin, and that leads to a rapid shedding of skin. And then that, combined with various drops or medicated drops that the patients put in the ear, may have formed this sort of crusty layer, dead skin sheath, I suppose, on the drum. That's just one theory. So again, struggling here a little bit. And again, in previous videos, you will have seen, quite successful and quick kind of jump off the drum it comes. It's usually much easier than this. But again, this kind of bottom layer here is quite difficult. And I'm just going to try again. This is ultimately going to need some more bicarb. More so, see, I'm just making some progress there, but it's just not enough. Which again shows that although I've applied one round of bicarb, again, this skin is very, very dry and thick. Just coming off the drum there. And incidentally, patients finding this very, very comfortable. You can actually see where it's attached right there. I don't know if you can see. So you can see the drum flexing a little bit just to that little segment, which shows that that bit's still attached. So just pulling on the drum a little bit, which is really to be avoided. We don't want to do any more than just gentle flexion. But patients finding this very, very comfortable. Again, the feeling that she's getting is just a very gentle tugging, not hurting. And again, she can hear, if the eardrum was totally exposed and nice and clean, she would find the sound of the suction extremely loud and comfortably loud. But again, this is, there's still a hearing loss there. So she's finding the noise level quite comfortable. Again, just pulling very, very gently here. And again, we can see the drum starting to flex. And we're going to need some more bicarb here. So I've just applied some more. Obviously, this is going to inevitably smear up the endoscope, which it always does. Or maybe not, actually. Yeah, there we go. See, it's just an inevitability, which is really, really annoying. Because then you have to exit out of the patient's ear and then wipe the endoscope off. But I haven't really found a solution to that yet. So, right, so now we should have a bit more success with this peel. Bicarb's gone in, moistened everything up, moved through the layer of dead skin, soaked into it, and now we should see a good degree of success. You can just see the eardrum underneath that bluish purpley loveliness. And there's going to be a little bit of, it's going to look, the drum itself is going to look a little bit what we call erythematic, or which is just a medical term for redness. But again, we've been working down there, applying bicarb and peeling the dead skin off. So although it's not been hurting, you will see a little tiny bit of inflammation, but nothing to worry about. But that's erythema, or I think it is derived from Greek for erythros, which means red. So there we go, lovely looking.